started here. Thank you to everybody for joining us today. Really excited for this one. We're going to be talking about SARS-CoV-2 biosecurity. This is an interview with Luis Alberto, Ochoa, Carrera. This is part of the BioRAFT EHS Community Connection webinar series. So this is a series of webinars where we are striving to bring together members from across the health and safety community from many different backgrounds and institutions, organizations, sectors, to help share ideas, connect, rediscover new best practices, just generally fight the spread of COVID, as we also try to do all the normal things that we've always been doing in our jobs. So really glad to have Luis on. And without any further ado, we are going to get started here. So just a quick reminder, Zoom webinar has a really fantastic feature called the Q&A feature. I guess it's not called the Q&A feature, but Q&A is really great as a place to store your questions and ask questions that you'd like us to answer during the live Q&A portion of the webinar at the end. They don't get lost as easily as they do in the chat. You can respond to each other's questions. So if you see somebody asking something and you think you have an answer, you'd like to follow up, you'd like more details, you can actually respond directly to them. And you can also thumbs up the questions you're most interested in. And that way we can sort of address the things that are most interesting to all of you. So definitely recommend asking questions throughout the course of the webinar. There will be some great side conversations happening, and it may help somebody else who sees your question realize they have a similar question or something else they want to ask. So definitely recommend going ahead, taking a look at that and asking away. And without any further ado, I will go ahead and hand things over to Luis. So Luis, thank you for joining us. I was wondering if you could tell us a bit about the scope of your responsibilities and also what you've been working on since the start of COVID.
Thank you so much, Matt, and also thank you so much for BioRAFT for having me here during this webinar and for the opportunity that you give me for sharing these concerns and lessons learned from this pandemic event. So, well, my role here at the Mexican Institute for Social Security is to be the chief of the epidemiological surveillance and research labs at eh&s. So eh&s, it's the acronym in Spanish. And a little bit of the Mexican Institute for Social Security is that it's the biggest social security institution in Latin America and in the country. So we provide healthcare services and diagnostic services as well for more than 50 million people in the country. And among these diagnostic services, there is a continuous monitoring of epidemiological surveillance of transmissible and non-transmissible diseases that are carried out in clinics, in hospitals, and other national medical centers. So in a normal day, we do a lot of work, and part of these responsibilities that I have right now is to help the laboratories in implementing and strengthening their existing biorisk management system and quality assurance systems as well, for having better results with a better opportunity, and of course to provide all our users the appropriate medical attention. So that is part of my responsibilities right now, and which are very similar from the responsibilities that I used to have when I was a coordinator of the Biosafety Level 3 laboratory at the Institute for Epidemiological Diagnosis and Reference from the Ministry of Health as well.
So would you say that, when COVID hit and when it really settled in, your job responsibilities and scope of your work really changed dramatically, or that was more just a continuation of the work that you were doing before?
I think that, and from my personal vision here, it's we added a new variable that was called SARS-CoV-2. I mean, in a normal day, eh&s processes almost 1 million of clinical analysis, just routine tests, and approximately 50,000 emergency interventions, more than 50,000 radio diagnostic studies. And we just need to add all the samples that are processed by our 7 epidemiological surveillance labs, because we also do other studies, such as HIV diagnosis, the diagnosis for vector-borne diseases, blood-borne pathogens, and also we work with the blood bank labs, which we have 54 in the country, and I help all these laboratories in terms of biosafety and biosecurity. So and as we are planning to include more laboratories, so we are worried about all the situational diagnosis that we have right now at every laboratory of our institution. The title of this presentation, of this session, says that it is biosafety for 60 million people. But if we just think from a global perspective, would be biosafety and biosecurity from a whole world. And I said 60 million because if we just wanted to be focused on our users, the people that we provide medical health services, it is just 60 million people in the country. But we live in the same country and we breathe the same air. So we share the same responsibilities. We share the same virus. And we just wanted to give them the same solution that can help them to improve their health and to have a better result as public health institution in Mexico.
So many of the people on this webinar manage biosafety, biosecurity, and just general health and safety at a smaller scale. Drawing from your experiences, what lessons or accomplishments could be valuable for a safety professional at a, just more or less any institution or organization that manages research and science that isn't a full-on country?
That's a very good question. I think that first of all, we will need to define the term of being a biosafety officer and being a good biosafety officer. I want to differentiate these two terms because being just a biosafety officer, or as we call here in the country, biosafety responsible, this is the term that it is used in most of the Latin America countries, can be just because the general director decided to empower someone else to do that task. And to be just a biosafety officer just require designation of responsibilities. But being a good biosafety officer is another thing apart. Before entering the discussion of the things that a biosafety officer or a biosafety responsible should or must know, there is a great need to understand the real need that each institution has by answering 3 basic questions. What do we want? If I ask all of the attendees, what do you want? A lot of them will answer, well, I would love to have personal protective equipment. I would love to have like more training, more specific training. I would love to have like opportunity for helping other countries or other institutions, or perhaps helping other colleague that is dealing with this battle called SARS-CoV-2. The second question would be, what do I need? And I really need to have specific SOPs. I need to have the technical competence for fighting this outbreak, and not only this outbreak, but to fight every emerging or re-emerging infectious disease. And the third question, it is totally different from the first one. That would be, what do I have? And what do I have? It's the real world in terms of the things that we have at our institutions. So I think that if we want to see the work that does a biosafety officer normally do, we can find some of these activities, such as provide training, perform risk assessments, receive and analyze several reports, We can have to provide orientation for making the transport of infectious substances from one institution to another. We can have to do several risk assessment of the diverse protocols that we can have. You need to always be available. That is like mandatory for being a biosafety officer, to provide feedback to the authorities, and also to convince your users, try to enforce them to comply with the applicable regulations in terms of a national perspective, a regional and international perspective as well. And to also provide good microbiological practices training. And also, one of the things that I normally share with my colleagues, my students, is that you also need to do whatever you need to do for mitigating the identified hazards at your laboratory or at your institution. Can be biological, can be chemical, can be radiological, can be ergonomical. So it doesn't matter. And also, based on the nature of the institutions and healthcare facilities that we have here in Mexico, you can find different types of laboratories, such as research, clinical, epidemiological surveillance, blood bank labs, vaccine production, quality assurance, and many, many more. So this risk assessment process includes all types of hazards that you must be identified in order to conduct an appropriate risk assessment of the identified hazards.
So,
yeah, go ahead.
I was just going to say, it really sounds like what you're talking about here is building this foundation of understanding your needs and your goals, right? What are you trying to accomplish? Getting general agreement on that, and then building off of that to understand, okay, well, what do I need to do then? What equipment do I need? What resources do I need? And then, of course, what are the limitations that I'm trying to work within that I can't change?
Yeah. Sorry, can you repeat that question again?
Oh, no, I was just commenting on your trying to summarize a little bit of what you said earlier. It reminded me a lot of what we've spoken about in past webinars, talking about how you just decide what you're going to work on and how you're going to be effective.
Yeah, and what I want to highlight also is that in terms of if we have like a comparison between biosafety and biosecurity measures that we have in our places right now, despite the great efforts that we have been doing in promoting biosafety at our institutions, at our academic universities, we haven't had the same success in terms of biosecurity, because biosecurity needs also a big understanding. And the biosafety officer or the biosafety responsible also is the responsible for educating and training the lab staff on what constitutes suspicious activity. And this is a very difficult topic to include in several forums in Latin America countries, because it is a part of the socio-cultural context. And if we seen like a general vision of all the efforts that several colleagues have been conducting in countries, we can have that they use biosafety cabinets, they have biosafety manuals, they have a specific personal protective equipment trainings for donning, doffing. And however, very little information has been shared in terms for controlling the transfer of biological materials. How are we using these biological materials in terms of specific research activities? Because we also, as countries, we need to comply with the confidence building measures that are necessary to be declared at the Biological Weapons Convention. And this is one of the hot topics that we have just starting to see as a result of the SARS-CoV-2 pandemic. Because right now in some countries, it's a big dilemma of if SARS-CoV-2 it's a select agent or if it's just a BSL-2 risk group agent. So I think that in this type of comparisons, we need to also try to put the biosafety and biosecurity on the same idea in order to promote the development of secure and safe procedures at our institutions.
Great. So building off of that, it sounds like there's just a lot of kind of high level and new considerations that you're having to work around and just navigate for the first time. Have there been any particularly effective efforts that you've undertaken that you could share with our audience that might help them?
Absolutely. In terms of, I would like to divide my answer. And in terms of biosafety and biosecurity, I will start with that. The status of the public health laboratories in Mexico in 2013 was critical, and was critical because 70% of these labs had evidence of a biosafety manual, the implementation and documented in the quality system of this laboratory. 60% had biological safety data sheets elaborated, just the 25% of these 60%. There were some laboratories that complied with some biological inventories that have been updated regularly. And there was evidence of a biosafety responsible in the laboratory with formal authority. And of course, in some institutions, the existence and presence of the institutional biosafety committee. But we had less compliance with other things such as defined biosafety objectives and the biological risk management policy that was appropriated, documented, and communicated. 40% of these laboratories only had presence of biosafety guidelines and its communication to the lab staff. In the same percentage, we found evidence of the risk communication process in the laboratories, and only 45% used to do some biosafety inspections.
Wow.
And on the lowest level, 20% of these lab only do a risk assessment using any tool such as the BioRAFT software or any other methodology. Just 20% do biological risk management audits, and were a lot of big concerns because not all the people that we were trying to communicate the importance of doing this risk assessment process really understand the impact that it has at our institutions. So what we tried to do at that time, and thanks to the help and support that we constantly received from the United States government and the Canadian Public Health Agency, we start organizing and conducting several trainings across Mexico. So we start having biosafety and biosecurity workshop with 3 different courses. These courses were in 2008, 2009, and 2010. And we trained 23 public health laboratories in Mexico and 10 members from the Institute for Epidemiological Diagnosis and Reference. And that was a very big number considering the context and the complicated situation that we can find in the country. So we also had 3 biological risk management workshops in Mexico City, sponsored by WHO, the CDC in 2011, and one in 2012 in June. And we also were very concerned about the things that how were we going to transport these biological materials for doing the diagnostic activities or reference studies. So we received the support from WHO, and we certify 15 responsible officers from the public health laboratories and 8 from the Institute for Epidemiological Diagnosis and Reference. And as we know that also we will need to provide the maintenance of this laboratory equipment, we design a training just focused on the maintenance and operations personnel of the 31 public health laboratories in Mexico. So we train them in how to plan, how to create and follow up maintenance of the laboratory equipment based on the WHO recommendations. And by the end of 2016, we had an increase of the percentages of the compliance. So with 90%, in all of the laboratories, there was an evidence of the biosafety manual and implementation in the quality system of the lab. 90% of the labs comply with having a biological safety data sheets and biological inventories updated. In the same way, there was an evidence of a biosafety responsible in the lab. And there were defined the biosafety objectives, the biological risk management policy. There was a very strong presence of the institutional biosafety committee, as well as evidence of risk communication, such as signals, hazards identification. There was a 75% of compliance with biosafety inspections and recommendations, and all this staff that was selected for conducting this type of work, the biosafety responsible, had received training in terms of basic biosafety, biosecurity, preparedness and response. And in terms of the epidemiological surveillance, which is the second part of my answer, the work that we do on a daily basis is that we work very closely with a multidisciplinary group of professionals, such as epidemiologists and other medical doctors. So the Mexico Single Information System for Epidemiological Surveillance, it's called SUIVE in Spanish, was created in 1981. And SUIVE disseminates weekly bulletins detailing the new cases of 142 diseases by subject, sex, and age group. So we try to do an integral surveillance of biosafety as well as epidemiological surveillance. And also, based on this general perspective, we promote a general biosafety and biosecurity at our institutions. So we have more than 25 different guidelines for monitoring diseases in the country, emergency preparedness and response protocols, such as in 2014 was the eventual introduction of the Ebola virus disease in the Americas region. The stronger quality assurance processes with the certification under the ISO standards, as well as the compliance. And we are, well, the compliance, I was going to say the compliance with the CWA standards, but these CWA standards are now migrating in terms of an ISO standard for biological risk management in laboratories. So we are right now in this transition process, and also we are constantly trying to share this expertise and training, basic and specific, to our community. And one of the things that has been very important for us is that we organize yearly events in terms of trying to invite all these public health institutions and try to focus in doing some trainings, these workshops in how to detect effectively these pathogens, and also how to monitor these emerging infectious diseases.
So it sounds like before SARS-CoV-2 hit, you had really invested quite a lot in terms of training public health professionals, working on this automated bulletin system, and kind of working in these interdisciplinary teams to get that in a format that would be useful for everybody everybody. So at the time when coronavirus came about, you had these really valuable tools to lean on that would help you. And you were able to sort of build off of those for more.
Yeah, absolutely. And we have been in direct contact with several threats since several years ago, such as outbreaks of emerging and re-emerging pathogens, natural disasters, social-cultural factors. So, like an example, we had faced the H1N1 influenza outbreak in 2009, the cholera outbreak in one of the regions of central Mexico in 2013, the chikungunya outbreak in 2014, the emergency preparedness and response against the Ebola outbreak in West Africa in 2014, the Zika and measles outbreaks in the Americas region in 2016, and the recent outbreak, without mentioning SARS-CoV-2 for sure, was the dengue outbreak in 2019 that affected the Central America region and a great part of Mexico as well.
Yeah, so maybe that speaks to this concept we stumbled upon a few webinars ago about pre-spring cleaning, right? It's never too early when you have the bandwidth to really try and build for the future, because when you need those tools, it's too late to try and build them in many cases. You know, you really need to get that created and working and tested so you can lean on them instead of trying to build them while you're also needing their help.
Absolutely.
Great. And then in terms of roadblocks or any challenges, have there been anything that you've encountered and overcome that's been particularly difficult? And then just if you could get into what the challenges were and then what solutions you came up with to overcome those challenges.
That's a very good question, and it is always, I love always talking about these things. I think that if we want to see how a virus is affecting us, I think that we need to see from a general perspective. And I mean a general perspective because what is really affecting us these days? Unknown outbreaks, the terrorism, the activities without conducting an appropriate risk assessment, corruption, unemployment, migration challenges, the excessive use of GMOs, and the use of unknown technology. And if we want to see the big challenges, the big challenge right now, it's COVID-19 or SARS-CoV-2 virus. However, I think that we are dealing, like a lot of countries are dealing right now, with limited support in terms of financial support, because on a normal year, and I said this because every time that Mexico suffers some epidemic or something, we receive a lot of help from our neighbors that are Canada and the US. But right now, every country has their own troubles. So they will need to be in charge of trying to solve their local and national situation. This has been very difficult for us. But also we realize that we already have these amazing trainings that they provide us. And all these lessons learned that we have been sharing from other countries, those help us in trying to provide a better response to this pandemic. Also, one of the big challenges would be the lack of specific resources in terms of Mexico has been facing a transition process in terms of migrating from one government to another government with trying to define specific policies. That has been very challenging because right now we're using all the existing laboratories in Mexico. Also, the big challenges are the new biosafety regulations, because we have seen the new ISO standard from Biosafety, the coming WHO manual, the new edition of the BMBL, the Canadian standard, and we need to define how are we going to integrate this information into our existing platforms. The big challenges also can include the language, cultural barriers, and of course the professional background, which is very, very diverse. And I think that one of the biggest challenges that we ever had, and it happened to us in 2009, in 2014, in 2016, and it happened to us in 2019, and it's happening right now. It's the lack of the appropriate communication for doing some specific things. Because I said that we are not dealing, and this is just a personal vision. This will not reflect the position or the opinion of my institution. But I think that we're not dealing with a virus. We are dealing with a pandemic of ignorance. We are dealing with a pandemic of lack of knowledge. And I think that it is at this moment right now when we need to be all together, because all of us, we are part of the same team to trying to respond against this virus.
Yeah, it's so true. We get into all of these hyper specifics about disinfection, about we're going to be talking about ventilation soon, bathroom safety, so many topics, but ultimately getting people to be on that same page, increasing mask wearing, having there be some standards and, excitement about responsibility for adopting those standards, social distancing are all things that just seem to be really hard for people to overcome. Have you found that there are any particularly effective ways for just helping to communicate to those people who may have a harder time, kind of agreeing with the knowledge base, maybe the people who are against wearing masks or who don't think that social distancing is as necessary, good ways of reaching them? Because I think that generally just that sort of communication can feel like you've bashed your head against a wall so many times with the people who hold these opinions, and it feels like there's no getting through to them.
Yes, the communication process is absolutely very important in terms of how are we going to share this information. And since the beginning, this is just the perspective from the country as well as the Ministry of Health, they were very concerned about which type of information was going to be shared with these biosafety professionals, with the healthcare staff. So we start creating and updating our specific manuals of how to provide medical attention without diminishing the quality of the attention. The COVID-19 changed a lot the way that we used to communicate, so we needed to find additional solutions. So we just start creating some leaflets of specific topics of how to donning and doffing appropriately the personal protective equipment, how to do the appropriate disinfection, how to share information with other entities. And of course, this information was also distributed among the population, which was not seen during the 2014 Ebola outbreak that could affect Mexico. So we try to do different types of information, posters, leaflets, try to create like podcasts related to how to protect ourselves, how to contribute, such as stay at home, do not go out if you do not need to leave your home, or just if you want to, if you really need to go out and do some basic and very essential things, just try to keep that in mind and do not go if there is a lot of people. These type of things were also distributed in the local TV channels, on the radio stations, on different websites from the Ministry of Health. And in just for mentioning an example, these websites include general information for the public, information for the healthcare providers, and information for schools that was also very important. And also, I don't want to forget this, but also information that we receive from other countries and institutions such as APSA International. So we consult this APSA website, the toolkit. it was absolutely very beneficial from us. And indeed, I helped translating some of these documents to that can be shared not only for the Mexican community, but also for other Spanish-speaking countries.
Great. Now, a quick reminder to our attendees before we move on to our next question. Feel free to go ahead and pop any questions you have for Luis over in our Q&A. It's a great way to keep track of the things you would like to have answered, as things tend to get lost in the chat function. And you can thumbs up the questions you're most interested in. You can respond to each other's questions if you have an answer, you'd like some more clarification, just something you'd like to build on. It's a great chance to have some side conversations there. And thank you to Tasha for jumping in, being the first one to dip your toe in. Really appreciate that. And we are going to move on to our next question as we keep going. So Luis, what elements of managing COVID continue to be a struggle, after we're settling into this 9-month period? Is there anything that is still feeling like it's not quite working very well?
I think that right now we are better adapt in terms of detecting and responding. However, there is a continuous concern in terms of the specific resources, because right now I would like to say that our first big deal was all the suspected and confirmed cases, what to do, who was going to be responsible for doing that, when, where, and how. So based on that, we conduct a risk assessment of the existing facilities, of the availability of PPE and disinfectants, the guidelines and the communication strategies. I think that was our first big deal. And that is not longer an issue anymore. So the second big deal that we also face in terms of responding effectively was having a measles outbreak at the same time that we have COVID-19. So having 2 outbreaks at a time really presented a very difficult challenge. In terms of availability of reagents, specific supplies, such as personal protective equipment, task forces, diagnostic activities, because we start asking us which was more important, SARS-CoV-2 or measles outbreak, but indeed both. So we need to establish the quarantine zones without considering these characteristics of each pathogen. So from one perspective, measles, a pathogen with an RO of 18. So it's highly infectious pathogen that was reintroduced in 2016 after the Brazil Olympics. And on the other side, we had SARS-CoV-2, a novel pathogen with unknown mortality, especially in Mexican population at the beginning. Rates specifically studied in Latin American population. And Mexico is a big country with a lot of diseases and comorbidities as well. So that was the second big deal. The third big deal was the outbreak that we suffer just in the middle of the COVID-19 pandemic. So we know how to deal with earthquakes, but in the middle of a pandemic, so that was a very complicated as well, because that also represents a big challenge, because people do not follow the basic hygiene measures, and that absolutely complicated the response. I think that the big deal that we have right now is to be prepared for the next big deal, and that can be another spread of infectious disease. That can be by do not having the appropriate resources. That could be because we have right now, and I think that would be the most important and big concern for me, the burnout syndrome that all the healthcare staff has after almost a year of dealing with this virus. So I think that that the limited supplies, and the huge differences in terms of the system capacity, the training, the experience, the perspective, and of course the resources and financial resources, I mean, specifically.
Yeah, absolutely. Moving on to our next question here, just again, talking about things that are difficult and kind of anticipating what the future might hold. Are you trying to anticipate and plan for how winter might change things? Kind of trying to, again, we're starting getting to see, I think, a little bit of that with the holidays here in the US at least, and expecting that all of the just stresses weighing down on people coming together potentially could lead to some really large spikes. But is there anything that you're particularly keeping your eye on?
Yes, yes, and we just started these alternative activities since the beginning of the outbreak, and I'm gonna explain why. Right now the installed capacity, or perhaps the installed capacity of laboratories at EHS started with 1,700 samples per day. They all and that was a very limited installed capacity, because we do other diagnostic activities such as other respiratory viruses, vector-borne diseases detection, exanthematic febrile diseases surveillance, detection of HIV, and many more. The laboratories at EHS comply with the Mexican official norm for epidemiological surveillance to monitor 27 different diseases in the country and more than 100 of international importance. And based on the things that we started doing since early March, today the installed capacity has increased to 6,100 samples per day, just for COVID-19, and just for 5 labs. So we are planning to have 7 additional laboratories by early 2021, for a total of 14 laboratories that will be totally dedicated to monitor the epidemiological surveillance diseases. And this will increase, for sure, the EHS detection capacity of SARS-CoV-2, but not only SARS-CoV-2, but also other emerging and re-emerging diseases, such as of importance for public health. So we also are considering, and we already have, the diagnosis of other respiratory pathogens at these laboratories that are located in Mexico City, in Guadalajara, Jalisco, in Monterrey, Nuevo León, in Mérida, Yucatán, and of course in Zacatecas. Zacatecas was the latest public health laboratory that was added to this list. And the Central Epidemiology Laboratory, which is based in Mexico City, in 2009 was created as a strategic response against the H1N1. And we validate the COVID-19 testing in just 1 week. Then we proceed to transfer this technology and install capacity to our network, which are the other 4 labs. And the complete standardization process was ready in 2 weeks. And we also send to these laboratories proficiency panels, and we obtain a concordance of more than 95% between all of these laboratories. So we also strengthen the presence of a biosafety responsible person in each one of these laboratories. And regarding the technical expertise, several institutions were involved in this training process. So we were not just talking about EHS. So we are constantly sharing information with other institutions of the Ministry of Health, such as the National Institutes of Public Health, the public health laboratories, as well as private laboratories as well. And as a result, we have now a good implementation of respiratory infectious diseases testing in each one of these laboratories, and have an opportunity standard of 24 hours to 48 hours. So we can have reliable results in less than 24 hours. So that is very good for our population, but also has been a challenge in terms of have access to the reagents, supplies, and for sure to put all this information in this big platform for epidemiological surveillance.
So it sounds like really preparing to increase the capacity of epidemiological surveillance with the coming cases that you're expecting, and just hoping that it's not something that's too overwhelming, and probably also trying to build in more flexibility for those sort of unknown unknowns that might pop up that nobody's expecting.
Absolutely. And right now, so we are just trying to do some, we already have these modifications of the protocols for detecting at the same time the SARS-CoV-2 and seasonal influenza. So because at the beginning, when we received those samples, some medical doctors were just saying that, well, we have this, we are suspecting of these individuals that had SARS-CoV-2, but what about the syndemic events? What about having SARS-CoV-2 and influenza, SARS-CoV-2 and tuberculosis? Mm-hmm. So just for mentioning an example, this laboratory of Zacatecas is our main laboratory that processes these tuberculosis samples, and they have a lot of experience doing this type of diagnostic activities. And we also wanted to create something that can help us in using in a more efficient way, the existing resources. So if we can have on a first screening test, if it's positive for SARS-CoV-2 or positive for influenza, then we can proceed to do the differential diagnosis for other types of respiratory viruses, such as other types of influenza, like H1N1, H3N2, or influenza B with all the lineages, such as Victoria and Yamagata, which are also considered in the respiratory panel. But also keep looking for other respiratory viruses, such as para-influenza viruses, coronaviruses, metapneumovirus, and rhinoviruses, just for mentioning an example.
Wow, fantastic. So really making sure that not letting the next pandemic get a jump on anybody during a current one, certainly. Great. Well, we are just about done with our questions here. I'm going to go ahead and remind everybody to please go ahead and drop questions into the Q&A for our live Q&A coming up. I'd love to hear from you, see what you all have to say, and I'm sure Luis would be glad to answer your questions. Now, a quick plug before we go on. We do have one more webinar here for the end of the year. This is going to be our laboratory ventilation best practices for coronavirus, talking about what are some good standards to expect for laboratory ventilation, roles of filters, designs, maximum space allocation, all of that fun stuff that I know people have been asking about. I'm going to finally get to dig into that. And in addition, I am launching a poll right now. So as I'm sure many of you have heard me say, these are the EHS community connection webinars that really relies heavily on you, our community, to keep these going, both in terms of letting us know what kinds of topics you're interested in, but also whether you'd like to participate as a panelist on a future webinar. You know, we have Luis, who really generously is donating his time to join us today, and we have normally a panel of 2 to 3 people who come on. And it just makes such a big difference to have really passionate, knowledgeable speakers come on and help to provide the stage where all of you can come together and talk. It's not just about our panelists ever, it's about the community we bring and the people who have that nice crosstalk and connections. So love to hear from you, both in what you're interested in, and also if you might like to be one of the people up here on the stage as well. Now, after the holiday break, we will be back on 1/14, and here is a sneak peek at some of our upcoming topics. So hoping that these will get populated and all set up and be ready for you to register for soon. And of course, feel free to participate in our prompt of the week. I'd love to hear from you, what you're excited for and what you're looking forward to for the coming break. Definitely wishing you luck on potty training your 18-month-old and spending time with family, always important. So without any further ado here, going to leave that poll up and check back occasionally on this prompt, kind of see where everybody's at for the holidays, and we will go ahead and get started with the Q&A. So Luis, the first question is from Dingsa. Dingsa would like to know, did you have any mixed messaging from the political establishment doubters, and how did you handle it?
I'm sorry, I didn't hear the last part of the question. Can you repeat it again?
Of course, yeah. So they would like to know, did you have a mixed messaging from the political establishment or from people who might, doubt things going on, and how did you handle that? So I guess, wondering whether you encountered any resistance to the existence of COVID, or people questioning whether measures were effective, or just generally encountering differences in opinion when you're trying to set up a policy. And thanks, I hope I represented your question properly there.
Yes, well, thank you for that question. We really found several barriers in trying to share this information, because we had different positions. So at the beginning, not all the scientific community was totally convinced about the existence of this virus, or that it could affect a lot of people in terms of a national perspective. So, and it is always difficult, because if you, I know that you perhaps you have seen the news saying that Mexico is not having a very good response in terms of controlling the spread of these viruses, as we are one of the countries with more cases worldwide. So I think that this has to be a lot, because we have a very wide and variety of culture in Mexico. So I think that if we constantly focus on try to educate and try to communicate effectively, we will have a different results right now. At the beginning, the messages that were given from the government were not totally clear in terms of specific measures, because from one perspective, our authorities mentioned that there was nothing to be afraid, because this was just something that was just happening in China, and this was not totally true. So this sooner or later was going to affect us, because the viruses, bacteria, fungi, and any other type of microorganism knows no borders. So these totally affect us, and also the communication from our administrative directors, and most of it from the Ministry of Health, were not totally clear. So every institution started working at the beginning by their own, trying to develop their own protocols, trying to get their own resources. So that's why we start seeing different type of resources, the availability of these ones. And so we decided to make a strategic stop, saying, okay, we need to be a better coordinate. We need to give each one of us the appropriate and right information. So we start managing the necessary and existing resources to have an optimal and timely response. We start participating in different sessions, webinars. We define which were going to be the service and quality standards. We start generating and coordinating the local, national, and regional networks, and try to focus all these efforts in terms of provide solutions to the public health concerns. I think that those were the biggest challenges that we faced. And of course, if you have very well informed people in your country, will be of great help. But unfortunately, a lot of these people access to these resources that were not totally credible. So they just start looking for news on the internet, websites, places such as Facebook, Twitter, with fake news. And these fake news in the middle of a pandemic can be totally devastating, especially if your leadership believes that this is not going to happen. So that was the big challenge. But thanks to the great effort of all our biosafety professionals, our healthcare staff, and in general, all the healthcare staff that it is right now at the front line, we have we have improved our perception of the risk, and now we do believe as a population that this is something that can have worse results if we do not do the appropriate actions right now.
Well, right now we are at 4 p.m. Eastern. That is when our webinar is scheduled to end, but we do have a few extra questions here that we'd like to get to. So Luis, I don't know if you have the time right now, if anything's come up where you could stay on to answer these two, but regardless, I'd like to thank you for your time here and thank everybody for attending for this last hour and joining us for this conversation.
Absolutely, absolutely. I have time to ask for to respond those answers for sure.
Okay, fantastic. So we'll keep going. So the next question here is from Lisa. Lisa asks, is PTSD affecting healthcare workers once the pandemic becomes more after vaccines are being considered? And then how do we deal with this possibility? So looking sort of a little bit farther ahead at the effects that working during this pandemic may have on our healthcare force.
Okay. First of all, I would say that vaccines are absolutely a big help, and this is something that is going to be part of the response that we need to take as a country and as a group of countries in the world. The use of vaccines here in Mexico, and I'm going to use this example. In the news recently, it was announced that Mexico was going to buy several million doses of vaccines. But the first big question would be, these vaccines, who are going to be to healthcare staff, or this is just going to be for other staff, or the general population, or the population that it is at risk. So vaccines should be considered, however, as any other measure that can be taken to control the spread of these diseases. Need to be proved that it is effective in the population. So a vaccine, and another example is that the dengue vaccine that we developed, because Mexico provided the serotypes for the vaccine, was not very effective in terms of protection. And so and I remember going to one meeting in Brussels and saying, and one colleague from Australia said, well, I celebrate that there's a dengue vaccine in the world. However, we do not know the side effects of this vaccine in our population. So we'll need to prove first. And having a vaccine, from my personal perspective, in a very fast way, can contribute to not having the specific studies that are required. And we will need to be worried about any other type of things, such as the preserve of the cold chain, and if this vaccine, especially in Mexican population, can give us the protect antibodies that we are looking for. So I think that if we provide to these healthcare workers this vaccine, it is a success, yes, and would be a big challenge to cover all these healthcare staff in the country. Sure. And then I will say that we need to continue working with all the mitigation controls, such as practices and procedures, the training, the education, and of course, any other type of measures, such as treatments.
Right. Yeah, I think Lisa was also asking about post-traumatic stress disorder and whether healthcare workers were at risk for that sort of once things have died down. Is that a concern that you have or something that you're currently looking at as a thing to sort of treat or be aware of?
Yes, also as part of these post-traumatic side effects, we start. I just want to share these because we start a few months ago a part of a study that was conducted at several hospitals, and this was called the Harley Protocol. And the Harley Protocol was a protocol that used a canine for providing therapy for the healthcare staff just in the middle of a pandemic. So this canine was, it is very famous. I can share a lot of pictures with you, and you can share these with all our colleagues. And this was used for providing this psychological support, because we know at that time that it was very difficult to be under that stress. And what we have seen of post-traumatic effects in terms of psychological perspective, we have seen people that it is afraid of getting infected. There's a lot of people that don't want to go inside COVID areas for doing their normal work, because also they're afraid that they will not receive the support, and there will not be available beds in the hospitals for attending them, for carrying them. So this is a big concern, and we are just right now trying to solve that situation, because we contemplate some measures, but we do not contemplate all these things that are affecting us right now. So, but we are still working.
Right. Yeah, it sounds like one of those things where I think everybody is aware of it and can only do so much in treating people as they need the treatment and trying to anticipate the population getting help when they need it. So final question here is from Dingsa again, wondering what measures does Mexico have in place to handle cases coming in from across the borders? How are these cases identified and handled?
That's a very good question, and this is handled well. We have had several cases from other countries, and basically what we do is like a epidemiological surveillance process. So we monitor all the ports of entry in Mexico, so airports, roads, and highways. And every state has their own epidemiological surveillance system that forms part of our national epidemiological surveillance system. So if one citizen or one person has symptoms or doesn't need to have symptoms of COVID-19 and wants to have medical attention right now, he or she is oriented to go to several institutions. And if we are suspecting that this individual has COVID-19 disease, we refer to the specific hospitals so he or she can be tested, and she or he will receive the result. And if in case needed, he can be hospitalized and receive the medical attention. Like an example, the Mexican Institute of Social Security, you need to be part of this regime for having access to these healthcare services. But since the beginning of the outbreak, the EH&s open the doors of their hospitals to provide medical healthcare services for all the people in the country as well. So because we are dealing with a national, with an national emergency. So right now we need to provide the best help and best aid that we can give to the citizens and the population as well.
Well, I think that is everything here. Luis, thank you so much for your time. I really appreciate you coming on and sharing all of your experience with everyone. Thank you to everybody who participated in our prompt today. Just getting to hear what you're all looking forward to is really nice breath of fresh air here. And after the webinar, you'll all have an opportunity to respond to a survey, letting us know what you thought of it. Please fill that out if you have the time. I just wanted to thank everyone again for joining us and hope that you have a great rest of the week, and see you in 2 weeks for our next laboratory ventilation webinar.
Absolutely. Thank you so much, Matt, for giving me this amazing opportunity. And thank you so much for all our colleagues that joined this session. It is always a pleasure sharing these type of things.
Absolutely. I will talk with you all later, and have a great day.